diamond. Now, instead of going to our GP to be prescribed medicine, we should cut out the middleman and go straight to the pharmacy. At least that's the message from the Royal Pharmaceutical Society, which is campaigning for a change in the law which would enable more pharmacists to become prescribers. But in an age where fewer community pharmacies are able to stay open, how is this going to work in practice? We hear from a lot of GPs, we hear from a lot of consultants in the NHS, we understand the workload's on them, we understand they're very busy and the time pressures and everything else. We so rarely hear from a pharmacist, so we thought we'd change all that this morning. Olivier Picard is owner of the Berkshire-based New Days Pharmacies Group, and he's with me now. Thank you very much for coming in.
Not at all, Sarah. Thank you for having me on.
What's it like being a practicing pharmacist in Berkshire right now?
Well, pharmacies participate in a lot of NHS services. Obviously, we do the dispensing of prescription. We do participate in a lot of public health services, such as emergency contraception, NHS flu vaccination. We do consultation with patients to help them take their medicines better, to understand the treatment. But to answer your question more accurately, being a pharmacist in Berkshire today is a relentless activity. We see a lot of people coming through the door. We see a lot of people trying to self-medicate, asking advice as to what will be the best treatment for them. And from the moment we open the door to the moment we close, it is non-stop go, go, go. A little bit the same as you hear with GP surgeries and hospital. You will often see a small queue in a pharmacy, people waiting patiently to be seen by the pharmacist. But I should highlight that pharmacists are probably the only healthcare professional that you can see without an appointment, and which is why actually the role that we play is vital within the NHS.
From what you're saying, it sounds as though you're doing a lot of what is proposed already, but you're not able to give people prescription medicines. You're not able to prescribe, but you are heavily involved in people's management of their conditions with medicines that you can buy over the counter, aren't you?
That is correct. And in fact, I see a lot of patients who want to talk to me in the comfort of my private consulting room in the pharmacy. And they talk to me about the ailment, and I often think, I know exactly what you need, but legally I can't supply it to you because it's a prescription-only medicine. So the model at the moment is I will refer you to your GP, you will get a prescription, and you will come back with a prescription, we'll dispense the medication. That delays patient access to treatment. It delays, in a lot of acute condition, a condition being treated quickly. But when you talk about long-term condition, actually often what you see is, I could perhaps adjust this treatment. It may require me to go on some training, to work in collaboration with other healthcare professionals, GPs in particular, but in helping people to manage their condition. And I'm not saying that we will manage the patient condition, because it's down to the patient to manage their condition. But actually pharmacists and the knowledge of medicine can play a great role in helping people to manage their treatment, and when they see something doesn't fit quite fully, rather than sending them to their GP, which is the only point of call that we have at the moment, the pharmacist should be able, with the required training, to prescribe, amend treatment, and perhaps help those people to manage their condition better.
So you are in favour of this then? Are you in favour of being able to prescribe these medicines, despite the fact that you already describe your workload as pretty relentless? Surely it would add to that, wouldn't it?
Well, pharmacy is all about skill mix. If you think of a pharmacy today, you will think of a pharmacy as the place where you get your prescription. And I understand that, although I think my customers in my pharmacy probably get a lot more from that than that, because, as I say, they all get their flu jab from me, they all get some consultation with me.
As many pharmacies offer.
And other pharmacies do. What is important that we understand is the skill mix is that we have the opportunity within pharmacy to train our teams to do more of the work that we do now, so pharmacists can become more available and use fully their knowledge. We have technicians that are excellent at preparing people's medicines, and if we can develop them further, then we can free the pharmacist's time and let the pharmacist see patients on an ad hoc basis, or even on a booked appointment basis, if that's what it is required.
From a logistics perspective though, if you were able to prescribe medicines that currently only a GP can, surely that would require you to have access to a patient's long-term health records to make sure that it's the right fit for them, to take into account any pre-existing medical conditions. And there are all sorts of implications of that, aren't there?
So, interesting you say that, because very recently the NHS has launched access for pharmacists to summer care records.
Okay.
Now, everybody has a summer care record, and everybody has been asked to opt in or to opt out. In fact, everybody was opted in unless you wanted to opt out. And 99% of patients have a summer care record that pharmacists can or will be able to access in the very near future. Currently, that is a read-only record, and therefore
so you can't
the
add to
pharmacist cannot add to it. What the RPS is calling here in management of long-term condition is for the pharmacist who can prescribe, who can advise the patient on managing their condition, to be able to write in the record so that other healthcare professional can see not only what the patient has been told and how it's been communicated, but also to see the value of the pharmacist and to be able to utilise the information provided by the pharmacist for the patient's benefit.
And to be clear, so that we understand what the Royal Pharmaceutical Society are suggesting here, are they suggesting that these prescriptions be available from a pharmacist for people with long-term medical conditions only? So, for example, it wouldn't necessarily cover somebody who has a throat infection and requires antibiotics. It wouldn't be a kind of one-stop shop for something like that, or would it encompass all of those things?
Currently, the RPS report is talking about long-term conditions.
Okay.
Long-term conditions such as type 2 diabetes, atrial fibrillation, which is a heart condition which can lead to an increase in the risk of stroke, but also conditions such as asthma and respiratory disease. We are now talking about the patients who are stable on their treatment and require regular monitoring.
Okay, small tweaks here and there, I suppose.
Correct. We're not talking about the unstable patient, which will still be seen by their GP and by specialist teams.
Yeah.
But a lot of patients will be seen, prescribed a treatment by a GP, for example, and then through careful monitoring, the pharmacist may pick up a trend. You know, think of the fact that patients on average visit a pharmacy more than once a month, and therefore the pharmacist will see the patient more than any other healthcare professional, and they may pick up on a trend and say, well, actually we can adjust this, we can make changes, minor tweaks to your treatment, which currently require referring patients back to GP, but in the ideal world would be that the pharmacist may be able to amend the dose, increase it, change medication, and all this would be done in collaboration with GP practices, so that they know this is happening and they know what the pharmacist can and cannot do. The other thing that I should add is, obviously, pharmacists were required to be trained as prescribers. I am a pharmacist prescriber. I qualified 5 or 6 years ago from Reading University. It was a postgraduate education that I did, and I think pharmacists will be more involved in such training so that they can be properly prepared for this sort of vision that pharmacy had for itself. Which
of course will require more funding. We'll go on to talk about that in a moment or two, and also the role of pharmacists in other countries and how other pharmacies around the world work compared to the model that we've got here in Britain. So more of that to come after the love affair. This is Everlasting Love on BBC past 11 o'clock. We're talking about the role of pharmacists in Berkshire right now. Mainly because we've had this news story over the last few days that the Royal Pharmaceutical Society is campaigning for a change in the law which would enable more pharmacists to become prescribers. With me in the studio is Olivier Picard, who is owner of a pharmacy group here in Berkshire. Explain the training process for a pharmacist and how that compares to a GP, because I think a lot of people often question this, and if pharmacists are going to start, in theory, prescribing medicines, people want to know that they are appropriately and thoroughly trained. So what sort of process do you have to go through?
Okay, so in order to become a pharmacist, you need to go to university. That's a 4-year degree. And then you go on to do a pre-registration year, which you can either do in hospital or in community pharmacy. So all in all, it's a 5-year process, which currently then allow you to practice as a pharmacist in the United Kingdom. What happens with the prescribing is it's a postgraduate education. So currently it is not in the curriculum of becoming a pharmacist. But pharmacists have the opportunity to do this postgraduate education and become independent prescriber.
What does that mean if you can't prescribe, though, ultimately? Can you actually use that qualification in any way?
Certainly you can. Currently, pharmacists who have done the qualification of prescribers will either work within a GP surgery, they may work in hospital, or like me, they work in a community pharmacy. Now, as a community pharmacist, I don't have an NHS budget, so therefore I cannot prescribe with or for the NHS.
Right.
So the work that I do is completely private. But what we're talking about here is pharmacists having access to NHS budget, so they can prescribe the drugs to the patient. They can help with the diagnosis, they can help with the initial prescriptions, and they can amend the treatment. But as I say, each pharmacist that goes through this postgraduate qualification will choose an area of expertise. And it could be that it's medicines such as diabetes or respiratory disease, but it could also be that it's travel medicines, whatever they choose. And then after that, the pharmacist will generate with their local surgery an area of interest that will benefit patient most, and work with their GP in order to be able to prescribe for those patients which are most at risk. And this will vary from area to area, and we know that the more deprived area have a greater health needs, and some pharmacists will have different role to play depending on where they work.
It's interesting because, as a suggestion, this is somewhat contradictory to the news story that was around earlier this year, and I know it's coming in fact, in the next few weeks, that more than 3,000 high street pharmacies face closure under government proposals because the Department of Health is saying that in some parts of the country there are more pharmacies than are needed. Now, on one hand, we're saying let's get our pharmacists prescribing more to take the pressure off GPs. On the other hand, we're saying, but let's close some pharmacies. So the two don't sit together, do they?
So the government is not saying we'll close down some pharmacies. What the government is saying is that we are reducing the funding to community pharmacy as a whole. They have also admitted when they launched their proposal last December that as a result of these funding cuts, they are expecting that between 1,500 to 3,000 pharmacies will close. Now, obviously pharmacy ownership varies across the country. I am a local independent pharmacist, and there are large chains, as you know. So pharmacy ownership is to say the least, varied. However, we think that independent pharmacists will be more likely to be affected, and the government who says that there may be pharmacies close nearby in town centres and everything, their cuts may not affect those particular pharmacies.
Okay.
And therefore, it is difficult to predict whether pharmacies will close, whether it's immediate, whether it's in the long term. But yes, the government has acknowledged way back then, earlier this year, that up to 3,000 pharmacies could close as a result of these cuts. We think we are going to be badly affected by the cuts which are coming on the 1st of December, and over the next 16 months will be very painful. It's what happens after that that we're unsure about.
Well, when you say it's going to be very painful, what will be the effects on the patients of that?
Okay, well, if you think of a pharmacy closing, the patient still has to have to access pharmacy, so they will be going to other pharmacies which may be further, or with some mobility problem may not be able to, and that would be a greater problem. They may end up back in a GP surgery. They may end up in A&E department if that's closer than going to another pharmacy. And I think we know that the health needs are, if anything, increasing for the population. And those long-term condition is one example of it, but there's a lot of acute febrile illnesses which also need to be seen, which the pharmacy can help with. What you're looking at with pharmacy closure is more pharmacy chains, seeing more patients, more waiting time in pharmacy, and ultimately, again, delaying access to treatment for patients.
Really interesting. Thank you very much for giving us your point of view this morning.
Not at all. Thank you for having me on.
That's Olivier Picard, owner of the Berkshire-based New Days Pharmacy here at the Pasadena's now, and I'm doing fine now. Travel You Trust on